Hello everyone, it's Mospriska here today. In today's video, we're going to be talking about gonorrhea. Of course, most of us know that gonorrhea is a sexually transmitted infection. Now, this infection is caused by a bacteria called the Neisseria gonorrhea. Most sexually transmitted infections are still gotten through the same way, which is through sexual intercourse, through unprotected sexual intercourse, like through the vaginal sex, the anal sex, and the oral sex. Now, gonorrhea in particular targets the moist and warm parts of the body, like the urethra. The urethra is that tube that channels urine from the bladder to the outside of your body. So gonorrhea targets your urethra, the eyes, your throat, the anus, the vagina, and the female reproductive organs, which includes the fallopian tubes, the cervix, and the uterus, which is the womb also. Anyone who is sexually active can get gonorrhea, no matter the age. But it's more common in people of younger age, okay? But anyone, so far as you're sexually active, you can get gonorrhea. So, like I said before, gonorrhea can be gotten through sexual activities like the vaginal sex, the anal sex, and the oral sex. In fact, sometimes you can get gonorrhea by sharing sex toys with someone who has gonorrhea. In most cases, people that have gonorrhea don't even know that they have it. So that is why it is easy for people to share and spread it. They don't know, you see, no symptom at all. They don't feel anything. So they just feel that they are free. And then you see people sharing it. But then there are also people who notice or observe the signs and symptoms that come with gonorrhea. Number one sign and symptom, how you would know that you've got gonorrhea. Number one is there is this pain, excruciating pain that comes when you are urinating. You see, the pain is just very severe that most times you have to cry out, you have to moan out before you urinate. Number two, and that is a very peculiar sign or symptom of gonorrhea, is there is a discharge from your penis as a man. There is a pus-like discharge, like something, the discharge is quite thick. It may be yellowish in color, whitish in color, or greenish in color. Sometimes if you wear a boxers or if you wear pants, you would notice that it is getting soaked, it is getting wet, like you're having discharges from your penis. Number three symptom is discoloration or swelling at the opening of your penis, like the prepuce, you see. So the prepuce may be inflamed or discolored. Then you know that there is a problem. Number four symptom is your testicles may be swollen. Either one of the testicles or the both testicles may be swollen. The fifth sign of gonorrhea is there may be itching and soreness in your anus. Remember I said that gonorrhea can affect your anus because it is moist and warm. So there may be itching and soreness of your anus. Even sometimes your anus may also be bringing out discharges. Number six sign is rectal bleeding or discharge. You may be having bleeding from your rectum or discharge. Seventh symptom of gonorrhea in men is that you will be finding it difficult to go to the toilet. You're feeling pain. Remember, I said that your anus may be swollen, your rectum may be swollen as well. So going to the toilet will be like hell for you. It will be so painful. Now let us go to the symptoms of gonorrhea in women. The symptom of gonorrhea in women may not be as noticeable as it is in men, you see, but also women can still feel or know that they've gotten this infection. Number one symptom is vaginal discharge, which may be greenish, watery, or creamy in color. So you just notice that your vaginal discharges has just changed. Number two symptom is pain or a burning sensation when urinating. Number three is you have the urge to urinate more. Number four is that you notice that it is either you're bleeding heavily or that your cycle has just changed completely. Number five is pain during sexual intercourse. Number six, you have sharp abdominal or pelvic pain. You see, You just notice that you're not comfortable. You'll be having this excruciating abdominal or pelvic pain down there. Number seven, you notice that you have itching and soreness in your anus as well. Number eight, rectal bleeding and discharge. And number nine, you would also have difficulty when going to the toilet. It may also interest you to know that gonorrhea can affect other parts of your body, which includes your mouth, your throat, and your eyes. Gonorrhea can be transmitted from the mother to the child during childbirth. How would you know that you've gotten oral gonorrhea? There is soreness in your throat. You would have, soreness in your throat. You have that burning sensation. You find it difficult to swallow. And then there is swelling of the lymph node in your neck. That is when you know something may be wrong somewhere. Let me go have myself tested. Symptom of gonorrhea in the eyes. Number one, eye irritation and pain. Number two, there is discharge from the eyes, which can be thick, which can be yellowish in color and very thick, like pus. Yellowish, it can be greenish in color. Number three, eyelid swelling. Your eyelid will be swollen. You see, in fact, your eye will just be messed up. You would know that something is absolutely wrong with your eyes. Now, I forgot to mention that when a mother passes or gives her child gonorrhea, it causes blindness. So, gonorrhea in children causes absolute blindness. Now, once you've noticed all these signs we've talked about, you just need to go to the hospital and get yourself tested. What would the doctor do? You may be asked, and some samples will be taken off from you. If you're a man and you're having pus-like discharge, it will be taken for culture and sensitivity. Your urine may also be taken. Some tests will be run on you just to confirm that you've got gonorrhea. And then what is the treatment for gonorrhea? It's antibiotics. But then remember, it is not all antibiotics that is effective. So that is why you have to get tested so that the results will tell you which antibiotics your body is sensitive and resistant to, so as to know how to eradicate the gonorrhea. Now, there is complications to gonorrhea. There are people who, when they get this infection, they just wave it off and feel that it will go on its own and just say, my body will fight for me. Really? So I'm here to tell you that complications to not treating gonorrhea. Number one in women is infertility. Number two in men is infertility as well. Of course, it causes infertility. Number two, it causes pelvic inflammatory disease, which mostly affects women. And it is also one of the main causes of infertility in women as well. Number three, it can cause ectopic pregnancy in women. Of course, it can. Number four, it can cause abscess formation in men, thereby leading to infertility. So, in a nutshell, gonorrhea can cause infertility. Now, for the prevention of gonorrhea, number one, you have to get tested 3 monthly. You go to the hospital, you go for lab tests, you check yourself to be sure that you are fine. The next prevention is when you get a new partner, please, you people should go and get tested because you really don't know their sexual history, you don't know where they are coming from, you don't know who they are sleeping with. So you just need to be sure that you are okay and they are okay, all right, before you start having sex with them. Number three, prevention. Please kindly use condoms. Condoms can help prevent some sexually transmitted infection, and gonorrhea is one of them. Okay, so in as much as I know that gonorrhea can affect the mouth, that is why you need to go and get tested, all round testing, so that you'll be sure that this partner of yours is free and clean. I know that you've learned one or two things from this video. So please help me to share this video so that others can benefit from it. Okay? And kindly like this video, share this video, and also follow my page and my YouTube channel. Thank you so much, and I will see you in my next video.